Hello everyone, welcome to this MRCP PACES YouTube series. Today we are going to cover a very important topic for the communication station, and that is going to be breaking bad news. So in the PACES exam, you have uh, two stations where you are meant to do the communication. And in those stations, you are only meant to be doing the communication with the patient or the surrogate. There is no Q&A or no interaction with the examiner in these two stations, where the communication between you and the patient is the only thing that's happening. Now, there are quite a few patterns that often come in these particular stations. And one of the patterns that is very, very common is breaking bad news. So in today's video, I'm going to cover breaking bad news station for MRCP PACES exam. Now to do this, I'm going to give you a structure that is called the spikes framework. Now, spikes it's an acronym. So I'll start with the first S, that is setting up the interview. So whenever you enter the room, the first thing you need to do is to make sure that everyone, particularly you and the patient or the surrogate, is aware of the settings. Now, of course, you will be in the examination center, you will be in a decent room and a clinic environment. There will be seats for both of you, but sometimes you might need to check the patient details because it's quite common that there will be a name given. So it's a good practice for any clinician is to make sure that the patient in front of you is the correct patient. So sometimes you might do that. Also, you start with a very open question. So introduce yourself. That's the first thing. So you go into the room, introduce yourself, and there will be some information in the question, like you are a medical doctor in the neurology clinic, respiratory clinic, whatever. So just make sure that you and the patient, you are both understand and you are both on the same mindset that you are going to start a conversation and your expectations aligns with what you are meant to be doing in that station. So that's the first thing. So introduce yourself, then say, okay, I'm doctor this and this. I'm a junior doctor, I'm a resident doctor, or I'm a registrar in today's clinic, and you have been referred to us for this, or something like that. And then the first question, always make sure the first question is an open question. Example, how are you feeling right now? How can I help you? So you can do something like this. So first is setting up the interview. Next comes P, spikes, P for perception, assessing the perception. By asking a question such as, what have you already been told about your illness? So this is again a very open question. What do you know so far? What have you been told about your illness? So this kind of questions, they set up a very good starting point for an interview. And then once the patient has given some information, and then you uh, take the cue and go into the details. But the first question, always keep it very general and broad and listen to what the patient is saying. So at this point, try to minimize interruption and listen to what the patient is saying. Most of the time, they will be very clear about their perception of the disease. If not, of course, you can ask questions about that. So that spikes I is invitation. Now, this is like you obtain patient's invitation. So it's useful to ask patient what level of detail you should cover. For instance, you can say some patients want me to cover every medical detail, but other patients want only the big picture. What would you prefer now? This establishes that there is no right answer and that the different patients have different styles. So it's a good thing is you always invite the patient to know how much they want to know about the disease. Like some people will say, "Oh, doctor, I don't want to know all the details. Just don't bother me with all the scan results. Just give me what I have. Just give me the diagnosis." But if you ask the patient, "Are you interested in knowing all the details about your scan and then I'll give you the diagnosis, or you just want me to give you the main diagnosis straight away? So ask this question. So that is invite the patient's invitation to divulge all the information. Now, this is some of the example. So let's say you have a lung cancer patient. After you told the diagnosis, you might want to tell the patient that there are a few ways of treating cancer. For example, chemotherapy, radiotherapy, although total cure of the condition is unlikely. Now, if they want to elaborate further, then you can say, I have the cancer doctor to tell you, and all those things. So basically, ask the oncologist to get involved after this. You don't have to answer all the questions. Never try to think that you know everything under the sun. So, of course, there will be some questions you won't know, and it's fine for you to say that I don't know the answer today, but either I will refer you to the concerned specialist who can answer this, or I will go back and discuss this with my consultant and come back to you. So this is a very important thing. If you're not sure about the answer, don't give any false hope or false answer or reassurance always. It's fine for you to say that I don't know today, but I'll go and come back to you. Okay, so that was knowledge. Okay, so this thing is knowledge. So how much information you are giving. Next comes E for empathy. So spikes last the second E. This is addressing patient's emotion or empathy. So basically, you have to demonstrate empathy as a doctor, and also you need to understand the emotions that the patient is going through. If you don't understand the reaction, you will leave a lot of unfinished business, and you will miss an opportunity to be a caring physician. And in the exam, because there is no Q&A with the examiner, you need to demonstrate the empathy and your understanding of the patient's emotion very clearly in the exam setting. So spikes, this is the E. Next comes another S. The last S means strategy or summary. Always outline your plans with your patient. You may want to tell your patient that you are available again in the afternoon clinic, and if he has any questions, he might want to ask again. You must make it clear when you are going to see the patient back in clinic. Okay, so some form of a follow-up. Give it 2 weeks, 2 months, whatever. So give some form of a follow-up when you are finishing your encounter with the patient. Also, if you are planning to refer the patient to an oncologist or to a neurologist, to some form of specialist, again, make that clear in this end of the scenario. And always provide some form of a way of contacting. For example, certain diseases have specialist nurses. There is some community team which you can refer the patient to. So if you have those kind of thing in your scenario, always offer them. But one of the typical scenarios is diabetes. So diabetes, there is a very well supported diabetes community team all across the UK. So in those kind of situations, always make sure that you signpost the patient to those kind of services. Okay, so we have covered spikes. Now, few common phrases that you can use for your exam. So these are, I understand your predicament and I certainly share your worry. So whenever you say these kind of phrases, you can memorize them. So this is easy for you to demonstrate the empathy that you are meant to do in the exam. Then the question is rather difficult to answer. However, I will get back to you once I have discussed with my senior doctors. So this is about a situation when you have been asked a question and you don't know the answer. So you can say this thing. Now, if I were in your shoes, I most probably will do the same. We are trying our best, hoping that your mother will get better, but unfortunately, then give the information. When you are starting with a breaking bad news, you can say, I'm afraid I have some bad news for you. So this is, you give a warning. Okay. Don't say, okay, straight away, okay, you have lung cancer or you have something. So say, I have some bad news for you and see the response. Give it some time. Okay. So don't deliver the blow at one go. Give the patient some time to get used to it. So this is how you take the conversation forward. Now here we have another scenario which we are going to perform and enact now. So I'll be playing the role of the patient here. I'll be acting as an actor. So I'll be playing the role of Mrs. Karen Craig. Unfortunately, we don't have a female doctor today, so I'll be playing Karen Craig role, who is a 30-year-old married accountant with no children. And this information will be given to you when you are waiting outside the room. And the information is very simple. You are a doctor in the clinic, and your job is to explain the diagnosis of multiple sclerosis. And so this is a scenario. You are about to see this patient who attended as an inpatient 3 weeks ago. You were away on annual leave at the time, so have not met her before. At that time, she presented with a weakness of her left leg, which had developed over a few days. She also gave a history of transient visual disturbance for a few days 1 year previously, and no possible diagnosis were discussed at the time. An MR scan of the brain and upper spinal cord test has revealed extensive white matter plaques, including periventricular lesion and cervical cord lesion. She was also found to have a delayed visual evoked response in her left eye. Again, something this is important for MS. A lumbar puncture has shown oligoclonal band present in CSF, which are not seen in the serum. And the job of the doctor here is to explain the result of the various tests and discuss the clinical diagnosis of multiple sclerosis. You should also answer any questions that the patient may have and discuss any other appropriate issues.